It's a very short survey. It's about only 7 questions. Were you able to get it, Holly? Oh, I thought you were back.
No, I wasn't. Do you want me to pull up the website?
You got it with the app? Okay. You got it with the app? Were you able to get it? Okay. Just go ahead and try downloading. I know it's difficult to see that, but it is. Can you have it on a PowerPoint, the link, like, or somewhere with difficult to see that?
I didn't bring my glasses, and that.
If you can just do Wellbeing Index on your app, I think that may be something to look at.
Okay.
Okay, I had it.
No, I was just going to do our website.
It's not on there. I have our website already up here.
Where? Okay.
Here.
Yes, if you. I put it here. About halfway down, Wellbeing Index. This is the page that shows you what to look for.
Yes.
WBI app for Wellbeing Index app. Hey there. Okay. I can't see.
Don't worry about it.
Okay.
Yeah, just leave it.
Okay.
Thanks so much.
Okay, and I'll listen.
Yeah. Everybody who's here was able to download that and do the survey quickly? How many were not able to do it? Wait, you're not able to do it still?
Sorry, I just watched the Inlet survey.
I'm sorry?
I just walked the Inlet survey.
Oh, sorry, yeah. So this is mywellbeingindex.org. We've asked people to just download that app. It's free. You have to register and complete a 7-question survey. For those of you who've already downloaded it, any difficulty? You were able to do it? Okay, Aaron?
I'm doing it through the website.
You're doing it from the website?
Yeah.
Is it easier that way or difficult?
I don't know if it's giving me full access. I just didn't want to put it on my phone.
Okay. I did download the app and I was able to do it directly also.
Okay.
Yes, and I retried it just about 30 minutes before coming.
I was telling her a little bit about the Wellbeing Index, just so for let me know on there.
Yes, and it's free for the European public.
Yeah, that's what I was telling her.
Careful there now. You'll be having a meeting with us.
No, I don't have time for that.
Good morning, Nick.
Thank you.
I got it at the city. It's fine. She had it done before.
Okay.
But I didn't know it was so I appreciate it.
Okay. You're welcome.
I'll tell them. Y'all will switch it. And then talk to them about the and I know the reason talked about the last
just city, except that this.
I don't know, they reached out, but I made a note of it the other day, and I know that you, and it makes sense, both.
Tell Calvin I said hello.
I did, yes, he's so kind of.
He's doing good.
Pretty good,
Still has a lot of back issues. He's had it for years.
He did really well for a while, and then, I probably did more.
The doctor used for back, Richard Pierce, who's also one of my reserve officers. I saw him Saturday out there. One of the meetings we had there. I almost didn't recognize him, but I scrubbed on it. I said, "Were you policing today?" He said, "Yeah, but I better get my hours."
When I first started going to my mom worked, I believe it was in Canada, and he was still available.
Yeah. He loves it.
Oh, yeah.
So I said, and I told him, I said, "Well, I hear you hired a partner, got me here quick." He said, "No, I can't. I got to earn some money." He said, "I just bring it on another partner."
First time I saw him, after
Absolutely.
Calvin,
He's good to work with. Like everything, this day and age, you can move where you let a deal go.
I know. But Calvin, we still see him and all of
It looks like the way all the officers are migrating up there handling the place here. Y'all been at it.
So good afternoon. For those of you just coming in, we are trying to see if you all can download this well-being index, My Wellbeing Index, and just complete a 7-question survey. It's free. We actually sort of piloted that with the Resident Advisory Board recently, and they were able to do it, and I tried it out this morning. This is a tool that has been validated, and it is free, and I've been using it for about 3 months personally just to see how it is. And it sends you your individualized data in graphic form and compares it nationally, and then sends you reminders every month. When Nico and others did it at the Resident Advisory Board, it took less than 2 minutes to complete. For those of you that have downloaded it, if you have any feedback, let me know. But we are looking at seeing if we can do something with this data organizationally, which is with a cost. So it's a free individual account, but for an organization, depending on the complexity of data you need, plus the number of people in the organization, the cost changes. So for those of you who were able to complete the survey, any feedback or any thoughts? How many of you were able to complete the survey? Okay, good. About 5, 6 of you at the back. Were you able to see your data? Was it helpful, not helpful? Okay, and basically this is to see the longitudinal data, so just think about it, let us know feedback, or at least tell your Resident Advisory Board members in your own department so that we can think about it on an organizational basis. So as usual, we have people who will be trickling in, but there's a lot of items we want to talk. So thank you all for coming here. This is our regular healthcare principles and practice session, and we do 4 a year where we focus on a town hall format of really looking at resident and faculty-related issues if we think about what the clinical and learning environment is all about. So we are looking at the 4 aspects. One is to make sure that we have efficiency, which is with both operational, patient, and physician and healthcare provider. But overall, how do we create a culture of learning and a culture of well-being? And to that effect, what we're going to talk about today is an update on some of the items that were brought by the residents to our knowledge, by the faculty to our knowledge through the various Wellbeing Task Force and Resident Advisory Board meetings, and also a discussion, open forum discussion in a safe space of any other options or other opportunities or concerns you may have. So I want to start off on a little sobering note with information, and I had the Chattanooga site up here, not sure where it's gone. Yes, here it is. So we are actually looking at September being the Suicide Prevention Month, and this is something that has been adopted nationally. This is a sobering statistics for us as healthcare professionals. I don't want to, I've been told to use the microphone again, sorry. This is not something that is an elephant in a room anymore. I think this is something that is spoken about very openly. Physician or healthcare provider death by suicide is the highest among any other population at this point in the United States. Our own organization was not immune. We've had at least 2 physicians and 2 medical students commit death by suicide in the past 4 years, which is quite a high statistics for just one state. So with that, I just wanted you to know about these resources. This is the University of Tennessee website. We have a well-being tab which has a lot of resources, and then thank you to Ms. Pam Scott, our GME director. We have a separate icon really talking about this. I wanted to just give you another resource, and we will play it now. It's only about a 3-minute video, which I hope we can get to this. I may need John to help me with this. Pam, do you know yeah, here it is. It's coming up.
Medical training is challenging,
It can be frustrating.
exhausting.
Overwhelming, especially when things pile up on you.
My marriage is coming apart. I took out $183,000 in loans.
I made a mistake, a bad one. Sometimes I feel like I'm in over my head. I just don't feel prepared.
Sometimes I think the real mistake was thinking I could be a doctor.
We all have our ups and downs, but if somebody starts acting really down,
Not able to sleep, or sleeping too much.
Shutting her friends out, giving her stuff away.
If somebody just doesn't seem like himself,
Not doing things he used to love.
Showing up late, not getting things done.
if somebody starts acting reckless or irritable,
Yelling at nurses, snapping at patients.
Drinking too much.
He might be feeling burned out, or depressed, or hopeless.
People who are smart and talented, they get overwhelmed, just like anybody else.
And when they do, they may find it even harder to ask for help.
Medical students and residents have higher rates of depression and burnout than other adults.
they have a higher risk of suicide, too.
That's something we all need to understand, the risks, and how to look out for ourselves and each other.
And when it happens, people say, I had no idea. I thought he was just upset.
I thought she'd get over it.
I wish he'd come to me. I wish he'd said something. I wish I'd said something. And now it's too late.
Suicide can be prevented. If someone you know is acting differently or really down,
Don't assume he'll get over it.
Say something. Say, are you okay? How can I help?
The best way to prevent suicide is to show you care and get the person the help he needs. So don't be afraid to ask straight out, are you feeling so bad? You're thinking about taking your life?
People want someone to ask. They want someone to care. Faculty, peers, friends, anyone can ask.
are you thinking about killing yourself?
And if she says yes, or maybe, or sometimes, here's what you don't say.
That's crazy.
One mistake isn't worth killing yourself over.
That's not going to solve anything.
What you do say is, I'm sorry you're feeling so bad. How can I help?
We'll get through this together. Let's get you some help.
Assume you're the only one who will reach out and get this person the help she needs.
None of us should be ashamed of getting help.
Getting help is the strong professional thing to do.
Let her know she has options, that there are people she can talk to.
Let her know she can always turn to you. Make sure she has the National Suicide Lifeline number.
And help her find someone she can talk to. Someone who knows how to help.
Ask the dean for student affairs or the program director.
If you think she's about to hurt herself, don't leave her alone.
Take her to the emergency room. Call 911 if you have to.
We all get down. We all have our bad days.
But sometimes it's more than that.
If you think something's wrong, the only way to find out is to ask.
Are you thinking about ending your life?
Don't wait until you're sure. Trust your gut.
It never hurts to ask. It never hurts to care.
It can make a big difference.
Any one of us can make a difference
All the difference.
in someone's life.
Thank you, and please make sure that every opportunity you get to share this information. We are here, I think we are here to really create this community of caring, and our doors are always open. So are those of all your program leadership also. So please do take this seriously, and if you all have any concerns, we have various avenues of help available. The resources are listed here, but I want you all to be aware of the Chattanooga LifeBridge program. With your support and help, it has been accessed by quite a few faculty, residents alike, and even a few students. So again, this information is available on your website. We have the Next Gen program, and then UT Memphis has a lot of programs that we have attached the link to our website, but I know that the students got that email from Ms. Kathy Gibbs and others recently in Memphis. We also have got the Wellbeing Index down here. So with that, I just wanted to bring this to your attention. Any questions or comments about this from anybody?
Next Tuesday, the 17th, is the National Physician Suicide Awareness Day.
Right.
That's sponsored by the Emergency Medicine.
The CORD, yes.
Yeah, CORD.
Any emergency medicine residents in the audience? They were the ones who actually took the lead, and thank you, Pam, for sharing that. On September 17th is actually declared as the National Physician Suicide Prevention Day, and I'm in conversation with Dr. Mendriata to talk about what we may be doing for the faculty and residents here. The Emergency Medicine National Organization, and I see some of them coming now, actually do have buttons that they provide, so I don't know if they're going to be getting some this year or not. So again, thank you all for listening. We have a lot of guests today, which I'm really grateful for. Thank you all for being here, and we have a few issues that we want to give you an update. And the one is we had talked about the true partnership that we have with the hospital. Looking at when we talk about physician well-being, there are so many aspects of it that are important. If you all remember, we started with, meeting the basic Maslow's needs of food and security and communication. How do we make sure that we have that for all our physicians, faculty, learners, and healthcare providers? Because of your help, we were able to identify some food deserts like the ER at night and some other places. I hope that is going well. Jesse and others, you all have all good? Thumbs up? Good. All right, the next big area was security. And for those of you that have been in those discussions, I really appreciate the residents showing up. I see Aaron and Jesse here. Jamie is taking her in-training exam today, and Nico sent me an email saying that he is tied up with the facial trauma in the OR. So couldn't be here, but we've had multiple discussions with the help of the hospital leadership and the university leadership. The last meeting was a powerful one. We had Dean Shack and Dr. Four, myself and Ms. Scott from the GME office. We had Dr. Keys and Mr. Spiegel and Mr. Loescher from the Erlanger Hospital. But more importantly, we had our community partners. We had Sheriff Hammond and Chief Deputy Garrett, and then we had Walden Security Chief Hedden, and they're all here today to give you an update and what the next steps are. I think the first and foremost, we want to just say thank you because your concerns are valid, your concerns are genuine, and your concerns have been heard. We've seen some improvements on campus already, and I will have Chief Hedden and Mr. Loescher speak to those. But what came out of multiple meetings is that we need to address the security not just in a silo, but as something that is organized and really with community partnership. And in the discussions that day, the leaders suggested that we actually create a community physician sort of safety coalition and see what can we do in an organized way where we address various issues. Simultaneously, under the leadership of Dr. Keys and Dr. Maxwell, they have a emergency medicine safety register that is ongoing, looking at the very ideas that you all brought up, a separate entrance area for the ambulances or metal detectors. So with all that, I'm going to step back and ask our experts to really share more about those discussions, and then hopefully there'll be some questions from the audience. So I'd like you all to, if you don't mind, again, I haven't done any justice to your introductions and your contributions. If you want to just introduce yourselves again and then share with us what your vision is. Dean Shack, please feel free to chime in also.
I will. Never back.
Hello, everyone. I'm John Loescher. I'm Vice President of Facilities here at Erlanger, and Walden Security is one of the departments that I have oversight on. And Phil can talk about some of the staffing changes and process changes we've done here on campus to improve things. I could tell you from the facility standpoint, we've added additional access control. You'll see those keypads and your proximity readers. You'll see a lot of those going in throughout the facility. We put in a lockdown capability of both emergency rooms, children's and the adult side. And you're going to see throughout the parking garages, Whitehall, for instance, is completed. You can see the other parking garages, the lighting has improved dramatically. We're going with all bright LED lights in the stairwell as well as the garages. And we've added additional staffing throughout the campus for security. And I believe a lot of these steps are helping tremendously. If you look at this facility, there is a total of 80-some perimeter doors. At any given time, if one of them is open, folks from the outside can gain access after hours. We put alarms on all those doors, and we have facility security now monitoring those alarms at night, so if a door is left open, they can go respond and see what's going on. So we've done a lot of things, and it's getting better. It's a continuous job to keep, it's everyone's job actually to keep things safe, and we're open for suggestions, and I'm going to let Phil talk a little bit about some of the staffing changes we've made.
As far as staffing goes, we've added an extra outside security vehicle to help patrol the outer parking lots. We've added another police officer to our emergency room staff, so there's 2 police officers in the adult emergency room. And currently there's an addendum to add a 3rd police officer for 2nd and 3rd shifts. And that's crucial for our safety in the emergency room when dealing with some of this gang activity. Having those officers there really makes a huge difference in our safety. Does anybody have any questions? Sworn police officers, either the City of Chattanooga or the Hamilton County Sheriff's Department, are contract employees through Walden Security.
No, I was just going to ask, those are paid officers that are either City of Chattanooga or Hamilton County Sheriff's Department who are working off duty.
Right.
But in their official, still in an official credential law enforcement.
Right, right. Yeah, they're off-duty police officers who come to work for us after their shift or before their shift, and they do a really good job and help us communicate with 911 dispatch and CPD and the Sheriff's Department. Whereas if we need extra police officers here, we can have them here in a moment's notice.
Are these extra officers already on board? Are they?
One of them is in the emergency room. We're waiting on the second addendum to be signed to add the third officer. As soon as that happens, we'll start staffing the third officer.
Right.
Other questions? Yes, Jim.
What's the typical timeline for that? Like weeks, months, when that addendum is completed and signed?
I guess that's probably going to hinge on what happens tomorrow at the board meeting.
Other questions, any other concerns from the residents about security?
You do think it'll be soon, though, even though you can't pin one a day?
Yeah,
correct?
yeah, there's a process for all the contracts to go through.
Okay.
I believe it'll be signed.
Okay.
So one in the children, one officer in the children's emergency room, two in the adult.
Right.
PD,
Right.
and then hopefully a third.
Oh, that will be the third one.
Oh, that will be the third.
Yeah.
Okay, gotcha.
So there's two right now, and then we'll be adding a third one to the children's side.
I got you. Thank you.
Okay.
Any of you access the library after hours? Any concerns with that? I know that was a concern that some of the students and residents had brought to us, that the Whitehall building access or just the safety around that area. I know, I appreciate the light that has been fixed, that it's brighter and more visible, but any other things, any other issues with that? So I have to assume it's better. And if you haven't, please try and look at that area, and I have accessed it as late as 8:30 at night recently just to check, and it was much better, the lighting, and it was easily accessible, but I haven't done it any later than that. I hear the students and some of the residents have said they study there till midnight, and then leaving is a little difficult. Scary. Again, I just want to reiterate, in case you all are feeling uncomfortable, you have to call security and they will come and escort you to your car. And what is that number, Chief Hedden, again, that they call?
The extension is 7614. That's the admin line. And for any direct emergencies, you would dial 6911. And that's only for Erlanger extensions. 7614. And if you're on campus, you can just dial 6911.
Emergency only.
Yeah.
Is available, and I think we make it even more visible on our well-being website if you want. Any other questions related to security? And then I'll hand it over to Sheriff Hammond and Chief Deputy Garrett to give us their thoughts about the community participation. All right. Thank you.
Thank you. I think this partnership is certainly something that we need to do. Of course, our hospitals as our providers for the medical care for our citizens all over this county, and the number of doctors and their training and their practices here is an essential part of what we do in anything to do with our first responders and our emergency services for everybody. And Chief, if you want to step on down here, I'm going to let you say something in a minute. You know, anytime we talk about security, and we're kind of an outsider looking in here as part of the partners, we're not on this on a day-to-day basis, but we're there to furnish not only some advice and some experience, but some resources, whether it be security officers or technology and some of the new security things. Most people are a lot more, feel more comfortable in having active participation in security, and that's generally speaking is having a uniformed officer, a certified police officer who has the training, can be on location and can respond instantly. There's levels of that security, and of course the active is the ones who are hired here that are have a full-time regular job as a law enforcement officer, who go through the academy and go through a minimum of 40 hours a year of specialized training in order to stay certified, 8 of which must be on the firing range to be proficient in their weapon. The passive, of course, is the ones that, the cameras that you see around us and the pass cards that you get in and out of facilities. That's not quite as a secure feeling because there's not another human being who can respond to you quickly. And we understand that, and we try to deal with that. Budget is the only thing that restrains us in what we do in security. We know that. Several weeks ago, I spent the weekend down at Queens Bay, Georgia, aboard the USS Tennessee, which is one of our largest and most powerful nuclear submarines. I was in the submarine service myself many years ago. That's where I lost my hair. I kept hitting it on the bulkhead and those things. If any of you ever been on a submarine, you know what I'm talking about. But as you approach the perimeter of that base down there, it's very obvious there's high security when you get near a nuclear submarine. And then when you get actually inside the gates and the second line of defense, and you start getting out near the pier where the submarine itself is, you see a much higher level. And then you get out on the gangway to go aboard, and you have armed Navy personnel at all times, fully equipped, fully prepared to engage you with deadly force if there's just anything out of line. Now, that's top-notch security. We all know that if you have that kind of security, we'd probably, in some ways, we'd feel better, other ways, maybe not. Because a lot of people just don't like guns, and they don't like weapons, and they don't like being in security. We, for far too long in this country, have gotten used to being able to freely move wherever we want. We are probably one of the last holdouts in terms of, from international position, understanding how serious security has gotten. I mentioned to some of you, I spent 3 years in the Middle East recently working with the Iraqis and 22 other nations in providing security for that part of the world. And so I know what it's like to walk into McDonald's and have armed guards at the door of a McDonald's just to get a hamburger. Well, we don't like that here. We don't even like to have some kind of engagement of security between us and the bank teller when we go in the bank to do business. But the truth is that we're kind of catching up with the rest of the world, and unfortunately we have to have this kind of security. So when we try to create security here in the city of Chattanooga, we try to do it as passively as we can, so that you still have at least a feeling that you have that freedom to go. But the point of it is we've got to ramp it up. I think this is a great thing to have this partnership for us to kind of come alongside you all as your in-house security deals with it. And certainly your chief has a lot of experience in the city police department and many years of law enforcement experience. My chief deputy recently retired, for those who don't know it, after 25 years with the city of Chattanooga. I've spent over 50 years in law enforcement myself. So I've seen an evolution of the type of security that we all come to recognize and know this there. And I always tell everybody, the first line of security is yourself. And that is taking an inventory of where you live, how you get to work, how you are observant of things going on around you, how you advertise unknowingly. I mentioned in the last meeting that simple thing is having a vanity plate on your car, or something that marks you as a physician, is not always the best idea. Unless it's going to help your income, I don't recommend you recommend that. I don't have my car marked with sheriff on it. Mine's got a government tag. I know some sheriffs that's got 4 or 5 signs and 3 or 4 antennas on their cars, and they like that. But we live a day and age I don't recommend that. So the level to which we're willing to go to protect ourselves is the most important thing. And with that said, I certainly am very much in favor of this partnership continuing as we share with you some of the technologies in the world of law enforcement that have come along to help. And then on your own, I would suggest when you see security manuals, you look at it, magazines, that you take note of the security measures that are here in the hospital for your protection, and that when you have ideas and suggestions, you do bring those forward. Now, you've heard just a little bit here in a minute. I'm going to actually ask my Chief Deputy to speak to more relevant matters as it comes close to home here on how we can help you, either through training or being available. One of the things I'm very proud of is we have a quick response time in this community, both in the county and the city. Almost instantly, you can have law enforcement. Some of you were observant of what we had at the UTC campus here just a couple of weeks ago, where there was a possibility of an armed person, and how quickly there was a full court press on getting security law enforcement on this campus to begin to analyze what was going on, look down the buildings, be cautious, tell people to be cautious of what they did. So, Chief, if you will step up and just explain a little bit about how we work with other police agencies in this community and with the chief here at the hospital in helping you keep yourself safe. Thank you.
Thank you. Well, I told the sheriff when I came in, this must be a Baptist hospital, because everybody's saying I'm going to come to you. I'll stand behind the podium. Thank you for being here today. It shows your commitment to safety with us and a partnership. Spoke a minute ago, as I mentioned, Chief Ed and I have a long history together, about 25 years at the Chattanooga Police Department. We're partners for a short period of time working patrol as a patrol supervisor, doing problem solving throughout the community together. Like to think we were successful with that. When you came in here today, you sat down in the back, kind of proved
just for our recording. Oh, you're recording, okay. I'm not comfortable with these either. Not very good at karaoke. You prove a point that we're creatures of habit. Sit in the back of the room, take the same way to your car every day, and things of that nature. It wouldn't be a good idea for us to come in as law enforcement or security and tell you how to do your job. So to be successful together, we have to sit down and we have to communicate and talk about what's important to you as a healthcare professional. We're all in the same line of work. We're just wearing a different jersey. We're all about helping people. So doing that, the different disciplines that we share, if we're not talking, working through problems together, we're not going to make your environment safe. We're going to throw bodies at it, we're going to throw money at it, and we're not going to see a return on our investment that we're putting into it, which is to keep you safe while you are helping other people. So the last job I had at the Chattanooga Police Department is I was the commander of special operations. So I was responsible for the overall planning and coordination of every major event that came in the city, from a presidential visit to the Ironman championships to Riverbend, any of that came into the city to put on a race, whatever it be. We were successful as a community because we worked together. The whole time that I was doing that, from 2009 to 2018, just this February when I left, we were tremendously successful as partners because we worked together every day planning how to execute something. So I don't see this as any difference in what we were doing then and going forward. So when I suggested in the last meeting that we establish together a public safety planning group to work on issues as the hospital moves forward with new construction, remodeling, issues that emerge, because nothing stays the same, we're always changing. If we're working together and talking about things, we can come up with real good solutions. So that's what I hope we do going forward, and I hope we don't stop that momentum. I appreciate what you do. We're here to help you do what you do best, which is save lives. And we want to work with you and partner with you the best way that we can to be successful. Anyone have any questions for the sheriff's office or for me specifically? Well, real quick, one of our vulnerabilities is the ER, and we know that, and it's happening across the country, and it's random acts of violence, people who are in the heat of passion, things like that. So that's a real primary concern for this group, and talking about how we mitigate what goes on or what could happen in there. You can't be worrying about your safety and care for other people at the same time and be on your game and be 110%, which is what that person laying there needs you to be. So going forward, we want suggestions from everybody, and we want input. Everyone's input and opinion has value. There's people that give me ideas that have never worked in law enforcement, ever, has no experience in law enforcement. But they share an opinion, a life experience, and value in a discussion that we're able to use to be successful. So like I said, thank you for what you do. We appreciate you. Anything we can do to help you, we're committed to you. Thank you.
Thank you all again, once again. Yes, Dean Shack.
Just want to let everyone know that this task force that you had suggested at our last meeting, this public safety task force, is a joint effort between the College of Medicine and the hospital, obviously. And I put together a list of individuals that I think should share or should serve on that committee, but it's still sitting in the C-suite. There's been a lot of turmoil in the C-suite over the last several weeks, as many of you know, and so there are a lot of things going on that has prevented that committee from actually being formed because it hasn't gotten the blessing of the CEO. But that will happen, and we'll get this thing going, and we'll have our first meeting hopefully before the end of the month. And we look forward to having your participation in that as well, and you and Sheriff Ammon as well.
Thank you, and thank you all again for being here and taking our concerns seriously. Before we move on, any other issues regarding security that we need to bring up or share here, or any other concerns you may have that we need to be aware of as we move forward with this? We will be talking about this again at the GME meeting, at the Resident Advisory Board, the well-being task forces. You can tell your representatives, you can send us ideas or concerns if they arise, and if you send them to me, I'll make sure that they're disseminated to all the members of the committees. With that, I just wanted to move on to the next agenda item. In one of the town hall meetings, and aptly so, there was a concern related to, which was brought up by faculty and by physicians and some of the chief residents, and that was, how can we address student and resident well-being if we don't think about the physicians? They are role models who they see. If the role models that the residents and students interact with are not engaged, they are not energized by their work, or they appear to be cynical, that was a concern that had been raised. And we had brought this to the Wellbeing Task Force, and it is not something that is not known nationally. How do we really address this simultaneously for all the healthcare providers? As you know, that we have actually had 2 longitudinal surveys already, 2016 and then late 2017, early 2018. We've shared those results. We've been sort of toying between whether that same survey needs to be administered or not. Thank you all again for coming. We appreciate that. Thank you. Thank you, Sheriff Hammond. So we had used validated tools of the Oldenburg Burnout Inventory Quality of Life Survey, and we have some good data. The second year, we actually expanded the survey to include the pharmacy and the nursing staff. For those of you who came in later, we started off this meeting by talking about a well-being index. We are looking at that particular tool because that is something that has gained a lot of national reputation, and we will send that link out to all of you. I really would like you all to try it and give us feedback. The individual survey is free. You have to register, but it is free. And some of the faculty have looked at it, some of the members of the Wellbeing Task Force and the Resident Advisory Board have tried it out, and it takes less than 2 minutes to complete. It gives you longitudinal data every month. If anything, it just creates a little awareness. There is a price to have an organizational subscription to that. Before we really commit to that, we want to see if that is the best tool we need for our organization. And your feedback is going to be crucial. So we will send you out that link again. Please give us feedback and try it out. It shouldn't take time, and we are also asking faculty to do that. So coming back to the concerns by the faculty, there were many concerns that were raised. The 3 main concerns were transparency of communication. They felt that things were not transparent. The second one was service over education, that they feel like they are asked to do a lot more with less resources and with less value to the other things that they do besides bringing in the so-called RVU, which you all probably know is the relative value unit. It is by the number of patients that you see. You get more RVUs, incentive bonuses and others are based on that. So our project here is actually called Bringing Back the R in RVU, Relationship Valued Unit. So to that effect, how do we build a partnership with the hospital which is really engaging faculty and making sure that faculty feel that they are valued? To that effect, I just want to thank Matt Gibson. I think he was here and he's had to leave, and his staff, Harley and Clark, who have helped us actually merge the strategic plan with the imperatives of well-being, which will be not just for faculty but for all residents and physicians also. So this was shared at the GME meeting, and I wanted to share it with you all also. So you all already know the data. I'm not going to go over it again. We all know that this is an epidemic, and it's something that needs to be addressed because there are multiple consequences to when you are not fully engaged and at your best taking care of patients. Education suffers, patient care, the big one suffers, more errors. There's a financial impact for every physician or healthcare provider that leads an institution, whether that's a nurse practitioner, or physician, to the tune of $250,000 to $500,000. You can actually do the math. There is a tool that is available where you can put in your recruitment and retention rate in an organization and find out how much money your organization is actually losing every year because of that. And then, of course, there is the tragic and the moral imperative where it's just the right thing to do. So we were aware of this strategic wheel, which is the new strategic plan for Erlanger adopted, Dr. Schacht, maybe 18 months ago to 2 years ago. Right. And when we looked at it, we really realized that what was missing in this was UT College of Medicine. So we brought that concern. Dean Schacht was very vocal with the hospital. So we talked with them, and they were very receptive. And we talked about how can we align what we want to create, a culture of well-being for all our residents, students, and faculty with that of what the goals and the strategic plan of the hospital are. And if we looked at each of these areas in the strategic wheel, there are consequences of not doing that. So for example, we first started off with, we need to highlight that this is we are an academic center, we are a teaching hospital. So, they did have this leading academic center in that. It is not as bright and obvious as we wanted. Dean Schacht is working on it. Hopefully we will have UT there, much more bolder, but this is a step, and hopefully it will happen. But, you know, they are looking at improving patient quality and safety, and that really fits with the quality imperative of creating a culture of well-being, whether that's medical errors, patient satisfaction, or access. If you look at the financial imperative, it fits very well with financial performance, which I just shared about. If you look at the operational excellence, that means whether you look at JCO, or the Joint Commission, or the DNV, which accredits the hospital, it's the same. It requires well-being and culture of wellness in it, just like the ACGME or the LCME requires. The educational imperative speaks to engagement. So with that, we worked and we incorporated well-being metrics, and we looked at what were the data that were already being collected in the hospital, and how could we then cull out of that what is the engagement and well-being sort of performance based on those imperatives. So we are looking at patient safety and quality and looking at the HCAP score and what are the root cause analyses, how many happen, what can be done to prevent those, how often are we debriefing about that. Looking at associate engagement and physician engagement. We've had some surveys done in our organization. We understand it's been a while. Again, it's which survey is the best so I think this is a good time. Sorry, some water to let us know. We have 10 minutes left. I have just one more informational item, and then I want to really open it up if you all have any other ideas or thoughts, because I'd love to hear from you all. The second major project that we were working on was communication and standardization of communication. I want to thank the residents. They have been very involved and very constructive in the feedback that they have given. And the issue is, for those of you who may not recollect or maybe new, is there are multiple modalities of communication. There are multiple areas where there is failure of communication that is timely, and it impacts not only patient care, but the life of physicians and caregivers. So we've had a lot of needs assessment meeting where we have looked and identified the communication that is already ongoing with each department. Where we are now is working with the IT department and Dave Peterson, who is the Vice President for Communications and Information Technology, to look at what is one system that speaks the language here and speaks the language that everybody needs to hear. They are trying to schedule a demonstration with MION, is what I understand. Again, with all the events happening in the C-suite, a lot of things have been put on hold. That's the extent of what I know right now. I know, Aaron, you have been very helpful and valuable in your information and experience. Do you have anything to add or share?
No, I think just figure out the way we use our pagers is mainly around pagers, but it's really important. We had that meeting a while ago about how we all use our pagers, and it's obvious that some departments are much more convoluted than others in terms of the call system as well. So I think that'll help everyone navigate physician-to-physician contact as well as nursing-to-physician contact, which is the major goal of all this. And we've heard a couple different entities being proposed, and it sounds like maybe the Epic one is the front runner right now, but we'll have to see if that actually works for everyone.
Mm-hmm. Thank you. Any other comments or questions? That's right. So they already have Epic in the hospital, so they're looking at what is the best way that we can utilize it to meet all the needs that we need. So that is kind of where we are right now, and it's not an easy task to coordinate multiple varied schedules and communication modalities that are already occurring. Any other comments or thoughts about communication?
Well, communication has gotten so technically advanced. We've come a long way from tom-toms and smoke signals, but you know, basically it's getting the point across by whatever method and whatever mechanism is implemented, and that's the thing that we're trying to decide. I mean, what's the best way to get information disseminated to everybody who needs to have it? And that's difficult. But anyway, it'll happen.
All right. Any other concerns or issues, anything else that you all want to share? Gosh, y'all are very happy, right? I remember town halls a year and a half ago. We had a lot of participation, and I hope that you all still feel that you have voice and agency. If you all had not brought up these issues, we would not have been able to tackle them in the systematic way and make improvements. Simple things and even very complex things. No other concerns? All right, you're very quiet today. Well, I appreciate all the work. I think I have to give credit to the various people, faculty and residents in your departments who are probably reporting to us when they come and meet with us in the Wellbeing Task Force and the Resident Advisory Board, because they are your spokespersons. So just, if you all don't know the names, those are on the website also, who are the representatives in your department, so you can always look at that. So with that, I just want to thank you all, and I think, Pam, we have a visitor that you would like to introduce.
Oh,
Yes, ma'am.
I'm like,
Kim did not know she was going to be introduced. We have a new staff member who in our GME office who will start on Monday, Kim Judd. She comes to us via the University of Michigan and then an HCA GME program in Florida. She is in a brand new position for our campus called a lead coordinator for GME, and she is meant to provide support to all the departments as needed. I hope to me, but this really is something that will kind of evolve. She most recently served as both a surgery and family medicine coordinator with the HCA program in Florida. So, and she has experience also as an orthopedic residency coordinator. So we are really excited. We had met via Skype in her car for the interview, so she came, stopped by today so that she could see the office and meet everyone. So I hope you will join me in welcoming Kim. She will become a fixture. She'll be working some with Jacqueline and your coordinator. So I'm very excited to have her here, okay?
Welcome.
Thank you, and welcome, Kim. She does have a lot of experience in GME, and actually she will be working around the culture of well-being, so look forward, and it was nice of her to be here today for this meeting. Well, with that, thank you all very much for all you do and for your partnership. Thank you.
Have a great day.
Thanks, everybody.